So good evening everyone. Welcome to Salud y Querencia, our web talk show with the Health Equity Council. So I am Carmela Nuevo. I work with the Health Equity Council, among other endeavors across the state of New Mexico, a medical sociologist. And we have put this show together with Anna Horner, who is also here in our background, our co-producer. This is our effort to engage community in topics that are not often shared or open to the public. And we want to get everybody talking about health and health equity and in all aspects of life, right? And so we are all, from New Mexico. We care about our community, we care about our state, we care about, everything that happens here on the ground, and we are part of that force trying to make change. So I'd like to introduce my co-host for the show this evening. And this is Camila Bird Romero.
Good evening, everyone. Camila Bird Romero from Ocoyoahuilco Pueblo. I am a graduate student at the Institute of American Indian Arts. I have received my BFA in creative writing. I'm now pursuing my master's in poetry. I'm an eco-poet, so I write a lot about the environment. I write a lot about feminism, maternity, generational power, things that have influenced our public communities. I'm very excited to be here and have these discussions.
Hi, everybody. Myla Garcia. I'm from Ocoyoahuilco as well.
So I brought the double O, y'all.
Yes. Very happy to be on board and be here with everybody today and be present on the show.
So we're gonna learn as much as we can. We have our special guest here, Pelatia Trujillo, who we met early on with the Health Equity Council. She is a force in the community, a harm reduction specialist. Pelatia was born here in Albuquerque. She has her MBA. She works on MBA, works for community growth, empowerment, activism, harm reduction, and public health. She has personal experiences with substance use, homelessness, sexual violence, all of these which fuel her passion. Today, she's going to talk about all of the endeavors that she has engaged in around harm reduction, dope services, working in the community, Crossroads for Women. So she is just a wealth of knowledge. I'm going to allow her to introduce herself and kind of give a little bit of that background. And today, we're going to be talking about harm reduction. What is harm reduction? What does it look like in our community? And most importantly, what does it need to look like? So we've been kind of on this road. And we want to see, where does it need to go? What's the next step? And where do we need to expand, scale? And, what are the barriers to that? So I want to introduce this special guest, and I want to thank you, Pelatia, for joining us here at the Health Equity Council on Salud y Querencia. And we're ready to party. So I'm going to hand it to you, Pelatia.
Hello, everybody. Thank you so much for having me on the show. I feel blessed and just happy to be acknowledged as a person that has a lot of knowledge around this, around harm reduction, right? I'm lucky enough to have a very supportive team in Albuquerque and New Mexico statewide. We are one of the leaders in harm reduction in the United States, right? And so we just want to recognize that moving forward. If you haven't heard of what harm reduction is, I would love to open up and talk about that, because there's many different ways to think about harm reduction, especially when we're talking about our communities and especially when we're talking about public health. A little bit more about my background. I am a health promotion specialist with the Health Equity Council. I'm also the executive director at Dedicated Outreach and Prevention Education Services. So we are an outlet for more knowledge and more trusted information in the community.
Thank you, Pelatia, for that wonderful introduction. I want to give a little bit of background, and I'm going to have Camila. She's going to talk a little bit about the topic of overdose and why harm reduction is so important. So a little bit of the background context.
Yeah, absolutely. So statistics are going to be really helpful, especially for those who are just tuning in, who are a bit more unfamiliar with this topic. So the biggest takeaways that we need to discuss right now: North America has the highest drug-related mortality rate in the world. Number one. The second, according to the CDC, overdose death went up 11.9% in 2021. That's a total of 108,000 deaths. Something that
is not spoken about often is that's due to the presence of the illicit fentanyl. So we are bringing that up, and we are raising that topic, and it is something we are going to address and talk about. Another statistic, and something for us to be aware of, September is National Recovery Month. So that's about promoting and supporting the treatment, recovery practices, celebrating and promoting those that are strong right now, proud recovery communities. And we really want to encourage people to continue on that recovery journey. It's a journey, right? It's not something that you first start and ends. It's an ongoing struggle and battle that needs to be recognized and celebrated. And lastly, September 21st is National Opioid Awareness Day, and August 31st is International Overdose Awareness Day as well. So just kind of some flags to raise up and make everyone aware of in the audience. Just, you know, these are usually hushed topics, but today we're here to bring those forth.
And I want to mention that New Mexico has led the nation for decades in overdose death. Previous research that we worked on showed that 1/3 of all of our New Mexican population has been impacted. So 1 in every 3 persons know somebody who has died from an overdose death or dealing with that right now. I also want to recognize in all of this, the families that are supporting all of our communities and our individuals, family members who are dealing with substance use and dealing with all of these like opiate. It has a tremendous impact on our families here in New Mexico. So I just want to hold space and hold up for those families that are in this fight right now, and also families that have been impacted or lost loved ones to this. So I always want to hold space for all of our family members and our community members. I'd like to move Philathea, for our audience. Can you define what is harm reduction?
So harm reduction is it's a philosophy that focuses specifically on reducing harm in life, right? And so a lot of times when you hear harm reduction, you hear substance use come into that conversation quite often. And that's because harm reduction is proven to work for people that use substances. The reason why that is because it opens up a lot of different avenues to not only have conversations, but to assess risk, and to kind of break down some of the barriers that you have with something being so hush-hush, right? When you don't have conversations about these things, there's not a lot of opportunity to get people access to resources that are needed, right? But there's also not a lot of opportunity for people to assess their own risk, right? If you don't know you're at risk or you haven't had that conversation about what that risk is, you don't necessarily put yourself into that category, right? And I'll use, this is not the only example, but I'll use like our elderly community, for example, right? A lot of those community members don't see overdose as a situation where they would be at risk, right? I'm taking my medications, I'm doing what I'm supposed to, but maybe there's something that we're not doing that we don't recognize as a risk, or something that we are doing that we don't recognize as a risk. If we don't recognize it, we can't approach it in the best, safest way possible. The other thing is being non-judgmental when we're having these conversations, right? Having a non-judgmental conversation goes a lot different than a very stigmatized judgmental conversation, right? Because stigmas reduce that access so much more. And when we're talking about stigma, we're talking about the labeling, the branding that we do as a society for individuals, especially individuals that use substances, right? But we do this in all different levels of life, like our homeless community, right? We see them on TV a lot these days because there's different actions taking place in our community. And a lot of the stigmas that come along with that stop us from getting these resources out, right? And also having very real conversations with the people that are most impacted. So giving people that space, that judgment-free zone, gives us a whole new access to like how we can help them, how we can communicate with them, how we can get them to resources, and identify other ways that other things that are happening in their lives that might also be harmful, right? Because we talk about substance use of like, that's the only thing in their life. When in reality, there's 30 other things going on. So we just talked about the pandemic and the increase in overdose, right? We talked about how that's affected us, but we're also not talking about all the other things that were going on during the pandemic. People were isolated, people were losing family members, people were getting health issues that they've never seen before, never were impacted by before. Long-term situations that we're not recognizing as being harmed because that person is using substance, right? And for a lot of people, using the substance is the harm reduction. And that's something that people don't often see. If I'm cold and I'm freezing in the winter, and I'm just using this as an example because not all people that are houseless or non-traditionally housed use substances. A lot of that's associated with the trauma associated with being houseless or non-traditionally housed, right? It's not the actual homelessness that's the problem. And I'll say homelessness because that's the traditional word we use, right? But it's really just non-traditional housed. That's really what it is. And when we talk about these individuals as just being on substance users, we really need to think about the other things that are going on. We're identifying them as substance users because they cannot hide it like we all can, right? I don't know how many people I come into contact with that are using substances on a regular basis. And we don't see that as an issue because they're functioning in our society naturally, right? But actually, they're just a lot, they have a lot more privileges in terms of hiding that substance, in terms of what resources they can get and how quiet they can be about those. So there's a lot of different things when we're talking about overdose. The biggest thing with overdose is having the conversation, right? So a lot of the risks that go along with not having that conversation, one, using alone, right? Feeling so ashamed or so uncomfortable having that conversation that you have to hide your substances, right? Also, not being educated about those substances, because there's a lot of things involved, right? When we're talking about using substances. When we talk about overdose as a whole, overdose just basically means putting too much of something in your body. The human body can only take so much of any substance, right? Any substance is going, if you use too much of it, it's going to have negative effects on how your body functions regularly. That's what overdose is. We're lucky enough with opioid use that we have something like Narcan or naloxone that we can use to kind of combat that overdose, right? Along with other different steps that you can take to help in an overdose situation, kind of like your fire extinguisher, your stop, drop, and roll if there's a fire, right? But we have naloxone. We're lucky enough to use naloxone for opioid overdose. But we have to remember that there's a lot of other overdose that happens as well. And most of the overdoses that we see, it's recognized that a lot of them are based on polysubstance use, right? So people using more than one substance. Right. It's not just that, right?
So you have three things I want to go back to. Resources.
Right.
When we talk about harm reduction, what are some of the resources? And then I want, if you could talk about what is Narcan. So we might have the people in the audience and they're not familiar with Narcan, they're not familiar with these different types of tools and resources. And this is something that you can actually train on and have some other. So I'd like to, if you could introduce Narcan as to our audience. And also know that the Health Equity Council is a resource, so that if you would like to be trained on Narcan, after she discusses it, we can talk about how we can get Narcan distributed to your community, to your home. This is something, and it's something that really needs to be destigmatized as well. So I'm gonna let you talk about it. I know you have the background for this, so.
So Narcan or naloxone, and you'll hear it two different ways, right? In some communities, you'll hear naloxone, and in other communities, you're going to hear Narcan. And those are one and the same thing, right? And what it is it's a medication that ultimately stops the absorption of that opioid in your system long enough so that you can bring the body back from some of the impacts of using or overtaking that opioid, right? And so this medication has been made very easy to utilize. It's actually a nasal spray that we have now that allows for individuals to use it at will, but also makes it very easy to use so that people feel empowered when they have it on them. They feel capable of utilizing it, right? Narcan only works with opioid overdose. What am I saying when I say opioids, right? What am I talking about? What are some of the substances that I'm talking about?
So fentanyl,
Right.
heroin, morphine,
Prescription.
prescription,
Prescription.
you could be prescription or illicit, you could have a surgery, you could
Heroin.
be sent home with an opioid to combat pain.
Mhm.
you would use.
Even the white one, Tramadol is no good.
Right.
And remember too, we have MAC treatment too, which is medically assisted treatment, which is actually utilized to help individuals, it's an alternative substance utilized to help individuals kind of wean off of other substances, right? And so those are also opioids, right? So methadone is also an opioid, right? Yeah, and Suboxone is too. Suboxone's a little bit different, maybe a little bit more difficult to overdose on. So anything that we're talking about in terms of overdose, there are ways to stay safe, and there are different methods that you can use when you're taking these different substances, right?
So who should have Narcan in their home?
So I would say anyone that has access to an opioid or opiate, right,
Anyone.
is
that
at
has
risk,
access.
right?
Every single individual prescribed an opiate is at risk. So this isn't just something that, right, that I want to make that really clear to the audience, that this is something that everybody should have in their home if they have access.
Right. And if we're not locking up our things, if we're not
Right.
putting them away safely or disposing of them safely, that puts us and our families at risk, right? But also, if you have these types of substances in your home and you don't have Narcan in your home,
Right.
that also puts you at risk. So I'll bring us back to the fire, right? We
Right.
all are required to have a fire extinguisher in our house,
Right.
right? So why do we not get these medications and require ourselves to have Narcan in the house?
Right.
You know what I mean?
So for our audience, how can we get Narcan in the hands of?
We have a lot of different resources in New Mexico. We are one of the lucky states where we have an amazing Department of Health that supports us with our harm reduction programs, helps us get out the resources that we need, and provides us with the tools that we need to make that happen, right? But we also have a lot of different organizations in your community that you might not be aware of that have accessibility for these things. So the Health Equity Council is one of them. We do have a program that focuses specifically on training and the distribution of Narcan, not only directly to community members, but also to organizations that already have that level of engagement with community that allows for these difficult conversations, right? Because just to stray off a little bit, if we're not talking about drug use with the people that are close to us, what makes us think people are just gonna walk right up to us and talk about their drug use? Drug use is a very hush hush thing, right? Because one, a lot of it is illegal, right? And so decriminalizing these substances or decriminalizing the use of substances is a big issue that we have today, right? Because this is a criminal, we're seeing this as a criminal act. And we're not seeing it as a need for treatment. We're seeing it as a need for punishment, right? And so that's definitely something that we have to consider as community members. These conversations are not happening unless you've engaged with that community member. So if I go on an outreach, I may have to see that person 10 times before they talk to me about what they really need, right? And that's because you gain a level of trust and respect. And you're also open about different things, but also within that space and that language that pertains to the situation, right? Or the culture.
So this is a really interesting example. I just wanna, what about teachers? So we've had a series of overdoses within, you know, school units, classrooms. I know in some of our counties that we're dealing with it in the middle school. This is something that teachers can be trained on, anybody in the, right? So how do we get teachers trained? So I know that you're a trainer. I'm just gonna put you on blast. So I know that, who do they call that they can, you know, maybe we have some audience members that are working in the schools and we think, you know, maybe all the teachers in the school should have a very clear understanding of how Narcan works. But how can we get teachers trained, or what other areas are, you know, what do we need to train? What do we need to put this Narcan in the hands of? And how can we do that?
So luckily, we do have access through many different ways, right? So if you are a teacher and you need a Narcan training and you need Narcan distributed to you, Health Equity Council is one of those spaces where you could do that. There's also many different organizations in the community that are providing these services, right? So specifically in Bernalillo County, we also have Narcan that's being provided through the Mass Detox Center, we have Narcan that's being provided through Turquoise Lodge, we have Narcan that's being provided through First Nations, Albuquerque Healthcare for the Homeless, the Hookup, Freewheel, I believe AIHB will be distributing some Narcan. There's just so many different community services. Dopes for
Hi, my name is Bianca Cowboy. I'm a program coordinator and harm reduction specialist for Dope Services. That's dedicated outreach and prevention education services. We are based in Albuquerque, New Mexico, but we go all over the state. We have a mailing program, so say you can't get to us, but you need stuff, we can mail it to you where you're at. We have so many amazing programs, but the whole reason Dope Services was founded was not only to make, harm reduction accessible, it's to erase and get rid of the stigma, the prejudice that people have against addicts, users, and I hate that word. But people that use substances, and we really want to make it available to anyone that needs it, whether it's Narcan training, you need Narcan to keep on hand with you. It's to make this available and give it to people, whether or not they think they need it. You might need it. You could be staying at a hotel traveling and someone in the next room or wherever overdoses, and it just happens to be on opiates, which is plaguing America right now. Everywhere across the United States it's going. You just need to know, these basic harm reduction procedures and how to help somebody, even if you feel however you do about substances, illegal, legal, whatever. It's really good just as a person to be in touch with your community, with the pain, with the trauma, with the stuff that they're dealing with. No matter how you feel about it, saving another person's life is never going to be something you can feel prejudiced or against.
Right, and I think that's a huge one. She did touch about, saving someone's life, because in reality, once someone's dead, we can't have these conversations. Let's just be real, right?
Yes.
And so, minimizing that harm is huge, right? Because we can't have those other conversations. We're also not realizing that we don't Narcan ourselves, right? Or we don't do emergency response on ourselves, right? So that means community members like all of you need that encouragement, that empowerment, that education behind what I can do in this type of situation. And let's be real, not everybody trusts calling 911 in our communities. It is not necessarily a space that all of us feel comfortable as Brown and Indigenous individuals, as community members that are dealing with marginalization. We are not calling 911 right away, right? And so we talk about overdose and we talk about the overdose death rates, but a huge one that we don't get to see is the overdose saving rates, right? We have community members with Narcan saving people on a regular basis, on a daily basis, talking about it, having conversations about it, and keeping each other safe, right, within their communities. And so that's powerful, you all, even though, New Mexico right now is the 12th highest for overdose, but we don't realize that these harm reduction programs that we have in place have allowed access to so much Narcan, so much educational information about the substances people are using, how they're using it, and how to stay safe.
I want to put this plug in also, is that we don't realize there's a lot of blame placed on New Mexico, right? Or, you hear these different myths about people trying to overdose out or they don't want to live anymore. We are so close to distribution hubs that the purity level of the substances that are on our streets, it is 10 times more potent than what it looks like in the other parts of North America.
Yeah, like say.
So your likelihood of experiencing an overdose, so it has nothing to do with the individual. It's actually the substances that are on our streets. So that's really important. That's something that's not often talked about. So distribution patterns of throughout the different streets, right? Here we have such high potency of different, so you're more likely to experience an overdose here when using illicit drugs than in other areas of the country. And so, a lot of people think it's New Mexicans, a cultural defect or these different things. I want to debunk that whole myth. This is not part of our culture. This was brought in. This was introduced externally. And because of the makeup of the population, it has been the last to receive resources, attention, and support. So we have over 100 years We have intergenerational opiate addiction as a result of the lack of support and infrastructure from outside, right, from our different communities. New Mexico has been at the bottom. We have not received the attention necessary. And so this isn't a cultural thing. This is something that was brought in intentionally. But like anything that's not addressed or not provided the support, you know, this is kind of the result. But we're a community that cares and we're a community that saves lives. And if we weren't, we wouldn't be here. So we are a community carer, and we do have one of the largest population of individuals who are dealing with and have family support. So we aren't the community that puts people out. We're the community that really takes people in and feed it. So we need to help each other out and really think of, you know, what are these different causes and how can we get these resources that Pelafia is talking about and this cowboy so that we can get them on, you know, into the hands of the individuals. Like she said, everybody is at risk.
Yeah, 'cause nobody talks about New Mexico in positive terms anymore. The fact our family values are so strong. And when you
Right.
come to this state, you're more likely to see someone smiling at you than versus like Los Angeles or Atlanta, you're gonna get like, you know, someone looking at you that way. And it's not just like the history of our state.
Right.
Well, no, that plays into it. Family values, community is so important here.
Right.
And that's not talked about enough or acknowledged enough. And New Mexico is a hub because I-40 runs right through here and I-25. That connects you east, west, north, and south.
Right.
Yep, and that's not talked about enough. What needs to be addressed is how these things are getting in, who's helping get this stuff in, because you know, the people on the streets, the community members using and buying this stuff, they're not the ones having anything to do with distribution. The resources have not been available to us for years.
Right.
Just like you said, in harm reduction, they have barely realized like, oh, wow, things are really, they need support, they need help in this state. They're barely starting to acknowledge and see that now, you know?
So now with this harm reduction and all of these resources, we can actually get this resource into your hand. Also, if you're wanting to train or you have a group of community members or somebody within your organization, it never hurts to know how to operate Narcan. We have a large population of elderly who are at major risk and, you know, often prescribed opiates and just, you know, so we have both. We're dealing with prescription and illicit, and it never hurts to have these things in the house. So let the Health Equity Council, let the you know, help you get the information that you need and get these resources. Pelafia is a trainer. She trains trainers, so she trains individuals to go out and train.
Yeah, so that's what we're here for. So I'm gonna put my sister on blast. So I work for Dope Services, right? She's the executive director and one of the founders of Dope Services. The whole reason she started that nonprofit, the organization, is because we both have family members, friends, people that mean so much to us that have dealt with substance addiction and have never gotten the help or the support they needed. And whether they overdosed or wherever they ended up, they didn't have the support they needed to tackle these problems that really someone threw at them. You know, these substances that get placed in our communities to continue taking us down. Black, Indigenous, brown, people of color. We are targeted, whether we want to acknowledge it or not. It's always going to be higher rates in our communities, like the Navajo Nation, #1 tribe, #1 group of people in the United States for alcohol overdose rates, coming up high on opiate overdose rates. There are so many issues people of color deal with, and in New Mexico, you know, we're really diverse, but the people that need the most help were not represented or acknowledged, whether it's politics, the media, you know, New Mexico is coming up for movies and stuff. We're not represented fairly anywhere. So it's up to you guys, you know, reach out to us. It doesn't matter if, you know, you have any kind of background or relationship with substances, illegal or legal. You could be anyone and help another person out and save their life. That's what we want to talk about and get to. We have to erase the prejudice, the stigma, and continue having these conversations about substance use. It just takes one person to start a conversation with another and continue and keep it going.
And to kind of add to that, because we hear addiction floated around a lot, right?
Yes.
And I don't know anybody who said, I used a substance and I wanted to get addicted, right? I also, it's also really important to recognize that not everyone that's using substances is addicted, right? And the reason why that's so important is because we automatically push people to treatment so quickly, right? We'll push them into MAT treatment. We're like, here's this treatment facility, not acknowledging everything else that's aligning that use, right? And maybe I'm not addicted to this substance. Maybe I'm using it carelessly for a specific reason, right? But maybe I'm not addicted to it. So let's explore that and talk about like what other reasons can be behind that use, right? Because that addiction, it puts that label on it, right? Like that's a bad person, that's an addicted person. That's a person that's not allowed to make their own personal healthcare choices. And that's a huge one, right? People with substance use journeys, they need to be able to be empowered to make their own personal healthcare choices just as much as the rest of us are, right? Because we don't necessarily know the background and the history and the historical trauma associated with everyone that we see. And so the treatment that you're talking about may not be right for them or may not be available, right? We talk about all the availability of this treatment, and we're selling this treatment that we cannot deliver because we don't have enough institutions to provide it. You talked a little bit earlier about safe injection and safe consumption, right? Which is a topic of conversation around the world now.
Right, I want to get to that. I really want to talk about these other forms of harm reduction.
Yeah.
And what's happening in Brazil and Portugal and all of these other that are very, very Puerto Rico, so, and they're offering these other, and what's holding us up here in New Mexico, in the US, and what is that conversation? What does that look like for us?
So in terms of state versus federal restrictions, we all know there's differences between the two, right? And so the reason why you're hearing about a lot of these safe injection or safe use sites is because a lot of other places around the world have safe use sites in place, and they're seeing a lot less overdose. They're seeing a lot less bacterial infections. They're seeing a lot less blood infections. They're seeing all these different things in a different light, right? They're getting access to people where they're using, when they're using, and providing that medical care and treatment, right?
So it's more of the medical, so more medicalized rather than criminalized, so we're still doing legalization.
Right.
So, and this is what's really triggering. So yeah, these differences, we have so much to learn about these different opportunities as communities that we can build, right? They've been proven, to have success rates, right? And when we think about, we always like to kind of disassociate, you know, that's the individuals who are dealing with substance, but their mothers, their fathers, their grandmothers, and, you know, the impact that it has isn't just on that individual, it's on the family, the extended family. And so we're dealing with something that we need to really address at that level.
Right. And
So
we need
that-
to be proactive instead of reactive. We've always been, we're reacting to the decision after, whereas we can intervene now.
Right.
Yeah, and the society we have, it pushes shunning
Right.
these individuals, right? Even though we're all families and we want to be there and we want to be supported, because the stigma in the society around us pushes us towards that shunning, right? And there's a lot of spaces where family is not the space to handle a substance use or addiction issue, right? Because there's a lot of different emotional and historical things going on, like we talked about. But it's important to give families the option to talk about these things. And a lot of families feel so uncomfortable talking about substance use, right? I see that a lot in our Hispanic communities and my family, right? Being half Hispanic myself, or half Spanish myself, and being in this community, I see a lot of that where my family members up north will not have a conversation about it, right? We're not talking about it, we're not bringing it up, and that's a huge thing, right? We're not talking about it, we're not bringing it up, therefore there are no resolutions or any actions. Yeah, absolutely. And when we're talking about these institutions, I mean, not only are we criminalizing substances, but we're throwing people into traumatic institutions
Right.
as treatment options, right? We're putting people in jails and prisons.
We're
consistently
dehumanizing them.
Yeah, for using substances, right? And the reality behind that is you're throwing them back into that trauma, re-traumatizing over and over and over, but don't get high, don't use, you know what I mean? Don't get well, because there's a lot of different ways to use too. There's getting high, there's also getting well, right? For individuals that are experiencing extreme pain and tolerance levels have affected the way they take that pain, right? But there's also people that are partying, right? People that are going out there and having a good time, and substances somehow go into play. And the largest substance that we don't even recognize as being in a negative light is alcohol use, right? We talk about opioids a lot and it's got this negative light, but when you're having a drink, right, you're fabulous, right? When that's one of the most toxic substances that we have. And because it's legal, it's looked at differently. So we're not throwing people in jails. Well, in some spaces, it is illegal to have alcohol, right? And we talk about some of our tribal public spaces, right? And some of these border towns that are providing things, there's a lot of barriers to that, right? Because understanding these sovereign lands and what their rules and regulations are something that people are barely stepping into when it comes to harm reduction.
So I did this question to my co-host and she has a question.
We want to make things a little bit more abstract here, right? There's a lot that we want to see, there's a lot that we want to see accomplished. Our audience as well, I'm sure we're all wondering, okay, how is it that we can move forward? And in a good society, it was a bit more proactive. So what are 3 concrete things that you ladies would like to see done?
So I would definitely like to see an expansion around what harm reduction is, right? Because once again, we talked earlier about harm reduction being directly associated with substance use, and that is true. But there are also a lot of other risks we're taking, y'all, in our lives that sometimes contribute to that substance use, right? Or contribute to other barriers in our lives that we don't focus on. So I really want community members to see harm reduction as a way of reducing harm in all public health settings, right? Food, nutrition in general,
Like
right?
you say, all the time,
Housing.
putting your seatbelt on.
Yeah, housing, right? Making sure that we're taking these different steps. If COVID-19 is out there, how do we do that in community? Safer sex options, right? Different things that we're not shining light on that we can also be safer in and provide different safety mechanisms for. Also, not thinking so big when we're talking about harm reduction. Our goal isn't just to get everybody clean and good to go right now, right? Our goal is getting one step closer to things getting better, right? Even if that person is just limiting their use, or they're eating more that day, or they're sleeping more that week, right? Or they're going to a doctor's appointment for that wound that they didn't get treated, right?
Right.
And so thinking about those little steps is also being steps that can be acknowledged and recognized as success. Because we're dealing with community members, and this is in a lot of spaces in the United States, we're dealing with community members that don't get to measure success in their lives very often, right? We don't get to see those measurements of success enough. So was that the second or the third girl going at it? It's one again. No, just kidding.
You're so right. It is one of those things where so many people, they want that huge accomplishment immediately. They want that overnight change, where it can't be that. You need to really celebrate, exactly. It needs to be realistic. Any little small step needs to be that triumph. Even getting through that day, getting through that minute, that hour, making sure that you step out of bed to even give yourself the chance for that accomplishment is huge.
I also want to, like, let's see, did I say the 20th thing? I want to talk about word enabling, right? Because when we talk about harm reduction, we hear that a lot as harm reduction specialists, and it's very stifling, right? Because enabling someone to do something is a lot different than saying someone to be safe. So Bianca just said, safe sex, right? Someone comes to me and they said they're having unprotected sex on a regular basis, right? For whatever reason, right? We're having unprotected sex, maybe I don't have access to condoms, or I'm embarrassed to get condoms, or whatever, right? Or I'm allergic to condoms, or whatever. Me telling that person, or giving that person a condom, or a dental dam, or lubricant, or whatever that is, over and over and over again, is not me enabling that person to have sex unsafe, right? It's me giving them the tools to be safe, yeah, right, the same thing with like us giving out masks, us giving out COVID tests, right? That's not us enabling people to go out and get COVID. Right, we're enabling people to be safer while they're being exposed, right? Seatbelt's another one, and I try to put these in different perspectives because I think it's important, right? If I'm a speeder and I'm speeding all the time, and I say, hey, there's cops on that street, you probably shouldn't speed on that street as much. I'm not telling that person to speed more. I'm just giving them some opportunities to stay safer.
Yeah, or even here's one that everyone can relate to. Don't look at your phone while you're walking. Put it down and look where you're going. You could either get hit by a bike or car or walk into a curb or just fall into a hole, man. Look up, okay? That's harm reduction. That's harm reduction.
Take those simple, yeah, that's right, and it's huge, because it actually, those simple steps have such a big impact on our lives, right? Oh, yeah. I know, I have a seatbelt. My daughter just got hit by someone the other day, and she had her seat on, thank God, because if it didn't, right? Something else could have happened, right? I'm not gonna tell my daughter, hey, stop driving, even though I wanted to. Your girl was scared, but yeah, you know what I mean? Like, telling her to stop driving isn't the goal, and it isn't gonna solve it. No, it just isn't.
Because free will, people are always gonna do what they wanna do, and I understand we all have our own morals, moral compass, the way we live, what we think about, the way we think about things, the way we see and interpret things, but we cannot judge another person for the decisions they make about their life. That is their life. This is something every person, especially in America, needs to get through their head. We cannot judge another person for the decisions they make about their life. It's their life. I understand it's your sister, your brother, your mother, your whoever. It is their life. That is their choice. What we can do though, as caring, compassionate human beings that care about one another, is make sure they have the tools and resources to do whatever it is they're doing safely. So they won't overdose or, catch whatever, whether it's something small or big, like chlamydia, anything, or get hit by a bus without their seatbelt on, or fall into a hole while looking at your phone while you're walking. These are all simple steps. Us as community members focused in and working in harm reduction can encourage and talk about and communicate to community members and each other to do. Harm reduction isn't just syringe exchange, safe use supplies, it applies to all aspects of life. You could never have touched or even seen a drug in your life, which I won't believe, but it's true, like simple, small steps and erasing the stigma behind it. Like, why do you want to judge that person for whatever they need those syringes or whatever for? We can't, we don't know their story, we don't know what they're going through, what their history is, what their family history is. But what you can do right now in this moment, you can be present and make sure you can give them the supplies, the resources they need to do whatever they want to do safely.
You bring up community. So talking about stigma, no one wants to go first, right? We don't have a good model. We don't have a good, healthy model. So what is it that we can see the city or the county? What is it that we can see them put into action to create that healthy model? To open up that, so no one feels, oh, we went first and we made this decision. We need to have that good healthy.
Well, I definitely think thinking about like opening the scope in terms of how they're caring for communities, but also community members that are caring for communities, right? Because we think about harm reduction as a whole and having capacity as a whole is a very difficult situation, even in a lot of different public health and nonprofit grassroots settings. We have a bunch of overworked, underpaid, stressed out, traumatized community members that are the social justice warriors we need to go out and make a difference. And they're so burnt out, they're so tired, right? That they can't do what they're so strongly prone to do, right? And that's go out there and be social justice warriors. So I would definitely tell the city, start putting more opportunity in that space for individuals to promote self-care, to promote, healthy healthcare choices for individuals that are on the front lines, to promote healthy engagement activities for these individuals so they're recognized by their communities, right? But putting some of those resources into the people that are out there doing this work.
But yes, thank you so much for our audience for joining us, and I'd like to open it up.
Hi there. Hi there. I was just wanting to say, I really like this work that you guys are doing. And I would like to see how the home visitors can partner with you guys. I mean, we're in the front lines and we're trying to make sure that parents are aware of their older siblings, even, their grandparents can, easily overdose too. So thank you for shedding that light on that.
Thank you, and thank you for joining us. I'm gonna jump back to Calathea because this dope res, aren't you curious about dope res? Yep. I'm curious about dope res.
So Dope Res is basically a program that's specific to our tribal and public community members and our border towns, right? And having discussions, community discussions and community outreach that's specific to these individuals and that also promotes their traditional healing, their traditional teaching, their elders, right? And whatever passages they're taking to get information to the community, right? And so Bianca Cowboy is our Dope Res coordinator. The goal with Dope Res is to be governed by individuals of Indigenous background, right? So we are in the process of building an Indigenous governance system specifically for this program so that all the information that's shared and all the programming that's provided is Indigenous led, right? We want to make sure that we're not just stepping in spaces where someone else could be more powerful, right? And community members are a lot more powerful in their own spaces. The other thing is, being a brown woman of color, and I'm just gonna say this, because maybe I'm too comfortable because I'm sitting next to this one. But in these communities, we want autonomy, like Bianca was talking about, and we're really sick of white colonials telling us what to do with our bodies and how to take care of them, right? And so really being able to address these at ground level and understand what community needs are. And Bianca, did you want to add to that?
We are decolonizing production, okay? We're doing it from a whole different lens, a different perspective, providing our Native, Indigenous brothers and sisters, well, Black, Indigenous, brown people of color, harm reduction services from our point of view. What we do, how we get involved in your communities, the opportunities and resources we offer to you. We want them to cater specifically to our people, for our people, being brought to by our own people. People that look like us, talking to us, telling us their experiences, what they've gone through, what they've been through, what their family has gone through, because we're dealing with generations and generations of intergenerational trauma leading up to all of these substance abuse issues, whether it's alcohol, illegal or legal substances. It's, so many generations back are problems in history that we have to address now in the present. And just coming at that from a different perspective and not an American colonial lens.
Indigenous.
Yeah, coming from, a place of love, care, and really respecting our traditions and the sacredness of our bodies and the life we get to live, the life we're blessed to live, and the earth we're walking on.
The stolen land.
Yes, the stolen land we are walking on.
We represent, I think we are on.
Yes.
But yeah, I think that's a big one, right? Is recognizing how connected individuals are with the land and what they're being told to do with the land that is so closely connected with our communities and who we are. And,
Do we have any questions from the audience? We do. Vincent, I believe you had a question for us. We'd love to hear it. Dr. Rorito, are you?
Yes, can you hear me?
Yes.
Good evening. Thank you for all that you've shared. It was really interesting listening to all the information you shared. Um, yeah, my thoughts were sort of what was discussed the last part of the discussion there about drawing upon Indigenous knowledge and community cultural strengths. I think one of the things that I've been really thinking a lot about is how do we connect our young people back to those ways of thinking, those knowledge, so that in line with some of the things you talked about, where we give them the tools, the lens, the paradigm to make their own choices, but also to have that information with them so that they make those positive choices. But the one thing that came up as I was thinking about this is also there seems to be a divide between what's available to urban natives. I remember you mentioned the First Nations, and they have resources here, but out there on the reservation, there's often not those resources. So I just wondered and I think it was kind of addressed in the last comments, but what is happening there to kind of bridge that divide between the urban and the more rural Indigenous communities?
So because a lot of these lands are federal lands, right? And like we said, we do have border towns, in New Mexico, right? So, but a lot of those lines make it difficult to make a lot of the harm reduction opportunities available in tribal and Pueblo lands, right? And so it's been difficult to navigate. Also, tribal government is a structure that not everybody takes enough time to be familiar with. Or are familiar with, and it runs differently than the structure that we're used to, right? So trying to get harm reduction practices and principles, we have to go through certain levels that we need to make sure and reach on these different areas and sovereign lands before we can make them available, right? And everybody is working on that right now. You'll see a lot coming from New Mexico Department of Health right now, and a lot of different communities on how to make this work and more accessible, because it is pretty violent, right? The other thing with our youth is, our youth. So one thing that we have a hard time recognizing as parents and as community members, right, is we're not always the right people to have the conversation. Sometimes we are, and sometimes parents can have that conversation, but it's okay if you're not that person, right? You can feel comfortable connecting youth with individuals that they feel comfortable having conversations with, or starting communication so that they start to grow that trust, right? Because in reality, when you are under 18, there are a lot of things that you don't have access to. You don't want to go to jail. You don't, and I shouldn't even say under 18 because our youth spectrum is a little bit wider now, right? But I think it's definitely important to mention that you don't want to share this information because you think there's going to be punishment behind it.
Right.
There's something punitive always behind it, right? I would like to say that I'm cool enough to always have conversations with my kids about all this stuff, but sometimes it's better to access a resource that maybe they're more comfortable being in, right? So opening those lines of communications is huge, especially with substance use, but also recognizing stigma when you see it and talking to your kids about it, right? Having conversations with your youth about what that stigma is and how it's affecting them, right?
That actually rolls into the next question. We have a Facebook viewer.
We're gonna share a little bit longer, everyone. Thank you
Yes.
for such a good conversation.
And this rolls in perfectly to what you were saying. So Janet on Facebook is wondering what type of healthy engagement activities. So you mentioned that earlier, right? So kind of talking with those youth, what are some specific suggestions or examples of healthy engagement?
I like it. So anytime that you're engaging with a youth, it's important to use other youth. I think that's a huge one. We don't turn to our communities enough for what their needs are. Sometimes I'm in meetings and I'm like mind blown because it's like, well, how do we get this information? And I'm like, well, ask community members. Well, how do we get this information? You should probably ask the community members. You know what I mean? And there's that professionalism divide often gets in our way, right? Because they're not that professional, or they're not in that
Right.
professional space. Doesn't mean they don't have the experience to be professional in what they're talking about, right? So we really need to have youth involved with engaging youth, right?
So
Also,
building youth coalitions,
Yeah.
building youth, inviting them to this table.
and training them to do this.
So training them to
They
go
do that.
out to, exactly, to be the trainers.
Right.
We, for some reason, you're so right, we, try to keep it at this level, and we are the only, when we have so many experts on the ground.
Michael.
Many experts.
And they're a lot cheaper than us guys, by the way. You know, because a lot of us are sitting around the table making a certain sum of money, right? And a lot of times the youth, they don't have access to funds like that, right? They don't have, so making some of those resources available to them, I mean, is an awesome way to not only invest in them, to show them, it's not just about incentivizing, right? It's about investing in your community members, showing that your voice at this table is just as valuable as this dude's,
Right.
Can
right?
you imagine our youth is being traumatized because they're witnessing so many overdoses? Can you imagine what it would do to the communities if they were saving individuals?
Right.
They
What
were
that would
empowered.
do to their power.
And the crazy thing is that they are, right? And we don't even see that, because we have youth that have Narcan, that are saving each other, right? If I'm at a party and something happens and one of us calls the cops, that person that calls the cops is going to be scrutinized for a long time, right? Or I shouldn't say cops, 911, right? Because there's a potential that cops could show up because it's a party, right? And so we don't think about that. A lot of this has to be private. Or else everyone involved is implicated, right? And not only from that situation, but the backlash from that situation, right? So that's why if we're giving these tools, youth can help other youth, right? And we don't give them enough space to build that power, because our youth are powerful, they're smart, they're resilient. And we're not giving them that space to be empowered, right? Giving them the chance to do it themselves.
I want to thank our guests today, and we're coming to with close end. Thank you so much. I'm Carmela Roybal, and I just want to thank everyone, and Anna Horner, our co-producer here, and our special guests, all of our wonderful hosts and guests, and thank you, and we will see you on the next one.